Thank you, Mr. Evans. I recognize Dr. Wenstrup of Ohio.
Thank you very much, Mr. Chairman. Thank you all for being here. It's wonderful to hear all that you do. I can tell you as a physician, there's nothing more rewarding than taking care of someone in need. And that's what all of you are doing. You know, in Washington, you hope that the name of a program or the name of a bill lives up to its billing, right? And so temporary, one, is the first word, temporary assistance for needy families, right? Very appropriate. And, you know, look, families all look different. They're not all the same. And not only that, every member of the family has different needs. And I think that that's sometimes what we miss out on this. Mr. Collins, you hit on something just as I came back in about the opportunity. You know, it's one thing to have a requirement, but the requirement's nothing if there's not an opportunity. And so how do we enhance the opportunities? And that's what I've always been about. You know, it's nice you can just say, well, you're required to go get a job. Well, that's easier said than done. You know, it's just not that simple for somebody who's starting out in poverty and then suddenly they need transportation to get to a job. There's all these factors that we all know come into play, and they're the barriers. So I think if we can focus more on opportunities, or at least allow at a local level that you can enhance opportunities for people, then the requirement, I think I like what you said, if I understood, Mr. Collins, is like the requirement should be that you participate in the pathway to an opportunity, then to job. That should be the requirement, and I agree with that 100%. Merely just saying it here doesn't mean it happens. We do that a lot here in Washington. Anyway, and it's not just the requirement, it's the result. And what does success look like? You know, that is the key. And I've got some great caseworkers in my district, and they're like, if they just let me alone to do what these people need, this family needs, this child, this individual or family, I can do so much more. And sometimes they have the opportunity, sometimes they just do it anyway and beg forgiveness later, right? You know, I meet a family with 6 kids living in a one-room cabin. He says, I can't take that third shift job because I got nowhere to sleep when I come home. Okay, do we need paperwork here to fix that? Or can somebody who's looking that family in the eye take care of that situation? In that case, she was able to, and they went to work. So what does assistance look like, I think, is a case-by-case basis and not something we can define right here in Washington, D.C. And that's where I think as we go forward and we want to make adjustments to this program, we enhance that. And also, is there a way to reward the success we're all talking about, which is somebody getting into a job no longer needing assistance? And by the way, when you get a job, we don't want to make it so that you're worse off than you were before you got the job, as far as financially and what your family can eat. So I think we need to focus on a lot of local flexibility for caseworkers. And, like I said, needs different. Whether it's getting your high school degree to be able to get that job, let's make that happen. You know, if it's transportation, let's find a way to make that happen. Whether it's childcare, let's find a way to make that happen. So I'd be glad to hear from any of you and to help us as we might change the parameters so that you all can be successful. And you're all wonderful people, but Ms. Gray, I don't think I've met a living saint in my life, but you're right up there.
Thank you, sir.
Mr. Collins.
Yes, so thank you, Congressman. I think there's more that we can do to reward work. Given all of the tools that are now in play, I think different than in 2005. States, I think, are trying to avoid penalties. They need to build an anti-poverty program, and in so doing, find more ways to reward work, spend more resources on rewarding work and helping people, ladder up once they get in. For example, income credits. There might be asset building match savings programs that can be added to when individuals go into work. And I think that's where we are. It really is about improving it and adding that kind of accountability from the federal level to allow states and counties really to innovate and to think through what is best for that family right there on the front lines.
And I would just add, ideally, that would be backed by evidence. You're a physician, and often, I would guess, when you treat your patients, you make sure you treat them in a way that the evidence backs up that that treatment, that pill, that drug, that surgery is going to align. And unfortunately, in too many of our anti-poverty programs across this country, we don't treat our poor people that way. We don't give them the dignity to give them services that actually work and have that causal evidence like you would in the medical community. And we should demand that of our states.
I would just like to say that our grandfamilies, some of them are not in poverty. They've worked, they've saved, they're now living the life that they want to live in retirement. And then they get a phone call and they're placed with children in their care. They're making $2,500 a month and getting denied from TANF because they responsibly saved their money for their retirement. And now, what do? They are at an age where they're not always employed or get employment, or if they're able to, they're medically disabled or they've got health issues and they cannot work. So the program needs to take in consideration that every family is not the same, and that these families that were grandfamilies that saved and put their life together are now moving into poverty simply because they're now willing to take care of their children and keep them out of the state's care.
Thank you all very much. Very helpful.
Thank you, Dr.